name is Tamika Lyman, and I am an MP student from Auburn University. I appreciate a moment of your time. Thank you so much. I realize that it's unlike money and you can't get it back, so I brought you lunch to compensate. So,
Thank you.
you're
Well,
welcome.
Auburn is a great school. I trained there.
Absolutely.
I got my MD, my pre-med degree there.
Oh, really?
Yeah, so it's a great place.
That's a blessing.
Yeah.
Well, thank you so much for your time. I appreciate you. I just want to ask you a quick question. Are you familiar with or have you taken care of any patients that have had diabetes?
Of course I have.
Of course. And so you understand the devastating impact that diabetes can have on an individual's life if left uncontrolled, right? We know that sometime an ingrown toenail can turn into an amputated toe, can then turn into a AKA and then a BKA, unfortunately, or a BKA and then an AKA. And so we know that we need to have it, keep it under control as much as we possible. So this whole year, I've been going through 3 different levels of evidence-based practice, one building on the next. And throughout my studies, throughout my research, I developed a PICO question to determine in adult patients diagnosed with diabetes, does the use of a continuous glucose monitor device have a greater effect on decreasing the A1C levels and glycemic events within 6 and a 12-month period rather than just finger sticks alone. And so I know you've taken care of many patients who've had diabetes, and I too have taken care of many patients. So my great quest have been, what can I do as a nurse and as a future provider help to aid a patient with diabetes and being able to control their diabetes levels. My target population are 18 to 65-year-olds with diabetes newly prescribed a continuous glucose monitor device. Throughout this 1 year, I've searched many databases, PubMed, Sentinel, Cochrane, case studies, clinical trials, meta-analysis, randomized controlled trials, research articles, and systematic reviews. With a collection of all of this data, I've made 4 recommendations based upon with the information that I've understood from them, and then I formulate my own 4 recommendations. And my first one is a grade A recommendation, and it's individuals with diabetes should be educated on the benefits of incorporating a continuous glucose monitor device into daily self-management, as it can trigger individuals of glycemic excursions and it can aid in lowering A1C levels. This came from 3 level 1 evidence-based and then 1 level 4. My second recommendation is a grade A as well. It's a continuous glucose monitor device. It should be incorporated in care since it has been valuable in decreasing hospitalization for individuals with diabetes. That too came from a level 2, 1 level 2, and 1 level 4 evidence. This grade A, my third recommendation is continuous glucose monitor devices is recommended for all individuals with glycemic variabilities and hypoglycemic excursions, as research has demonstrated the continuous glucose monitor can detect and thereby decrease the duration of these episodes. And that came from 4 level 1s and 1 level 4 evidence-based practice. My fourth recommendation is providers should acknowledge and address the perceptions and satisfaction levels as individuals, as it relates to individuals using a continuous glucose monitor device, as it would demonstrate support and thereby promote adherence. And this was based upon 2 level 1s, 2 level 4s, and 1 level 5 evidence. During my setting assessment with you all several weeks ago, there was really nothing that I can determine that you all needed to be incorporated or could be added to what you all were doing, other than when I asked you, are you all the only ones that educate the patients about the continuous glucose monitor devices once you prescribe it? And you shared with me that you were. And so based upon that, I also collected the information that roughly about 65 to 75% of the 300 patients that you all see combined, based upon the 3 physicians that are here, about 65 to 75% of them have diabetes. Also, patients are scheduled every 3 months for a follow-up visit for their A1C levels, and that their lab work is drawn in the lab by the phlebotomist prior to them seeing you, and so you'll be able to follow their A1C levels. There were some perceived barriers, not saying that they were a barrier, but the perceived barrier was that you all were the only educators for the continuous glucose monitor device, and about 50% of the 100 people, or the 100% of people that I asked here in the facility about the continuous glucose monitor device, only 50% of them were familiar with it amongst your staff members. Of course, you and Dr. McLeod and Dr. Taylor were familiar with it, but some of the staff members weren't familiar with it. Also, I perceived barrier was the younger population may have poor self-perception while wearing the device. Okay, so what I thought about was, what can I do to help reinforce the need, or reinforce the dire need of education for patients with with diabetes, to prevent all the associated complications of it. So I thought that it would be good to have an educational enhancement program. You've been to the doctor before, or been to an appointment and you've been prescribed something new, and maybe the doctor may have educated you about it, but because you were so overwhelmed with maybe the diagnosis of it or this new information, you didn't really gather it all. You really didn't have a clear understanding of what they were talking about. So what a new implementation of education would look like is, I can train your nurse, your medical assistants to be super users. Once you prescribe your patients with the diabetes, the continuous glucose monitor device, the nurse and the super users can then come and take them into a small room, and they can let them watch a video, about a 2 to 3 minute video of the continuous glucose monitor devices. And you know that there's many different devices that they can use, but that would allow them to see it and hear about it. Then it'll be about another 3 to 5 minutes where the patients can actually feel, see, and touch the different glucose monitor devices. Lastly, about 5 to 10 minutes can go into them just being able to answer it, clear up any kind of misconceptions, or get a chance to ask about anything that they may not be aware of as it relates to continuous glucose monitor devices. In 1 to 2 weeks, once the patient received their continuous glucose monitor device, we're encouraged them to come back to the facility, and we can help them set up their continuous glucose monitor device. And now they'll be able to understand what it looked like, what it entails, and the impact that it'll make on their life, as well as to give the caretakers an opportunity to get familiar with it, and they can set up the device on their phones as well, so they can understand what their loved ones' blood sugar levels is as well. Patients will be encouraged to set a short-term and a long-term goal, with the evaluation process of 3 to 6 months for the just short-term goal, and 6 to 12 months for the long-term goal. Ultimately, the main goal is that the A1C levels become within normal limits, and the glycemic excursions will decrease. And so the evaluation process will be monitored every 3 months, and every 3 month intervals on the 3 month return visits for the A1C level checks. Also, I would encourage them to maybe get into some support groups, some diabetic support groups as well. And that's all. Do you have any questions or concerns?
First of all, I want to thank you for your time and for an excellent presentation. And I would like to just share with you and reiterate a couple of things. It is very clear that diabetics who look at their feet have fewer amputations. Diabetics who monitor their sugars have better control. Obese people who weigh themselves weigh on average 10 pounds less than ones that don't weigh themselves. Obese people who read labels weigh less than ones who don't read labels. So your decision to educate the doctors here and the staff here is very helpful. And it is clear and obvious, and all the data seem to imply that people that measure and monitor their health care, ones that do better. And the lower the A1C, the fewer the amputations, fewer neuropathies, and the fewer deaths. For every 1% reduction in your A1C, there's a 34% reduction in your death rate over the next 10 years from a diabetes-related problem. With all those things in mind, with your focus on helping us to achieve better results is greatly appreciated. And any instructions you'll give our staff and our patients will be greatly appreciated. And I think you're absolutely right that we should become super users for these devices. And I know you mentioned perceived values and perceived barriers versus ones that might not be true barriers.
Right.
I do have some patients who reject it. I do have patients who won't stick their fingers, period.
Right.
I have a few that only check their sugars when they're here, otherwise you can't get them to check it. Of course, they change their attitude when they go through hospitalization with DKA and get near-death experiences. They get better.
That's right.
I guess in terms of questions, is this the initiation of the research? Is this the end and part of your research?
Well,
this data gathering, or this is data sharing after you gather the data?
This is data sharing after I've already gathered the evidence. So for the past year, I've been just compiling information, looking through different database researches, meta-analysis and all this. And so I've collected all this data over the past year. And so now I'm showing, based upon this data that I've looked through and researched, that this will be the best course of action to take when it comes to educating patients with diabetes to help manage and maintain overall health and healthy outcomes for their glucose control.
Okay, well, I appreciate all the information you're sharing, and I can concur with you that the more education that we give, the better off our patients and our staff, and even we, the doctors, will be. We often know things academically. A lot of times we know that great blood sugar control improves outcomes. We know that great blood pressure control improves outcomes, but sometimes we get inertia in that we refuse to go beyond certain points. So some patients who've had blood pressures of 180, we get it down to 145, and they said that's enough. And I said, well, our goal is to get to 125.
Yeah.
And they said, oh no, I'm too dizzy to get it down that low. Well, I said, well, let's try it. And you get over the dizziness, you'll start feeling better. You shouldn't, but it is very difficult to overcome some of the inertia from patients and from staff,
right,
and from physicians. So by having these continuous glucose monitors, maybe we'll be able to overcome some of the inertia and see what the real facts are.
Yes.
And go from there. And we can see when the sugars are going up, and we can try to work on the fact that, yeah, if you have a half a cake every Sunday afternoon after church, maybe if we can just cut that down to just some sugar-free something, maybe that's where it is. So all that information would be helpful for us.
Yes.
So I appreciate your presentation. I appreciate what you're doing in the field of diabetes. It's a very important disease. It frightens a lot of our patients, and a lot of them are frightened of sticking themselves.
Right.
And what you emphasized in your presentation that I'm bringing back up is that diabetes is a killer.
Yes.
But as we can see from the DCC T trials, and a few other trials, is that good control leads to decreased death rate.
That's right.
And decreased cardiovascular events, etc. So we shouldn't have a fear in patients of poorly controlled diabetes, because it's not diabetes that's the problem, it's poorly controlled diabetes.
That's right.
And the monitors will help us with determining how we can improve the control of the poorly controlled diabetics, and therefore decrease the complication and mortality associated with the disease. So I'm happy and thankful that we have this information, and we can improve by becoming super users these monitors so that we can monitor our patients and decrease the complication. I could speak a long time, but I know time is limited. I appreciate you for the work that you're doing, and diabetes is a very important disease, and thanks again for coming. We appreciate it.
Thank you.